I am Dr. Ashok Mukherjee. I am MD Medicine, PhD, Fellow of Indian College of Physicians, and practicing medicine, basically cardiodiabetology for last 40 years. Now I will discuss about some salient features of systemic hypertension. As you all know, hypertension is a major risk factor for cardiovascular and cerebrovascular morbidity and mortality. Actually, as far as statistics goes, hypertension is responsible for 57% death due to stroke and 24% death due to coronary artery disease in India. In India, actually, hypertension is a global problem, not only cardiovascular and cerebrovascular, it also affects kidney and is responsible for a lot of target organ damage. However, the basic points for my patients is to diagnose hypertension and monitor hypertension for their personal advantage, because the diagnosis of hypertension is important for a lot of events, cardiovascular, cerebrovascular, renal and others. Actually, measurement of blood pressure is important on regular basis, because now a home blood pressure monitoring has become available to diagnose hypertension at home, which is very unique, because home blood pressure monitoring can give an idea whether the patient or the subject is hypertensive or not, and whether he can seek advice from a medical practitioner or healthcare professional if needed. Say after the age of 40, the blood pressure checkup is essential at regular interval. If the patient has any level of blood pressure which is high, say about more than 140/90, he should seek the advice of a medical professional and have his first lifestyle modification and then medicine as advised by the physician or cardiologist. Actually, for home blood pressure monitoring, the patient must be apprised how to actually measure the blood pressure. Nowadays, a good number of methods or machines are available for their personal use, which can be used personally without any hesitation or without any problem. And home blood pressure monitoring is a unique guide to assess the severity or measurement of hypertension and to seek medical advice as and when required. And the home blood pressure, depending on home blood pressure monitoring, the patient can come to know whether he is hypertensive or not, and if there is any positive family history of hypertension, he must be very serious to measure blood pressure at regular interval and seek medical advice as required. And then the device of measuring blood pressure should be accurate. The patient must be apprised to measure his blood pressure accurately so that he can go to the doctor as and when needed. And if needed, the blood pressure medication can be given by the doctor as and when required, because the patient is to be individualized. The patient had some family history of hypertension along with some other problems of, say, diabetes, renal disease in the family, and the positive family history of hypertension. The patient is more prone to suffer from hypertension at the old age, particularly after 60. You know, hypertension is basically primary and secondary, of which 90 to 95% are primary and 5 to 10% of secondary hypertension. As I said, all patients must be individualized depending on their genetic predisposition, whether there is any positive family history or not, and then lifestyle, and then the other backgrounds, whether the patient is smoker, alcoholic or not. So environmental factors are also there. These are all have to be kept in mind. Whenever a patient of hypertension comes to me or to a doctor, the first advice is to go for lifestyle modification in the form of, say, stoppage of smoking, alcohol, moderation in alcohol, and then low salt diet you should advise. Physical inactivity should not be there. You should make exercise at least half an hour to 1 hour, 5 days in a week on a regular basis. That will help in helping her reducing hypertension. And then there are some other factors. The next comes the medication part. Now, depending on so many factors, depending on the history of, say, hypertension, diabetes, kidney disease, the medication should be accordingly prescribed. Each individual has to be prescribed individual prescription, that is to be kept in mind. And home blood pressure monitoring is essential in the regard that it reduces the cost also. In this regard, ambulatory blood pressure monitoring will be more helpful because that can give the right assessment of nocturnal hypertension regarding deepers and non-deepers. I think the basic or salient features, as I said now, should be made clear to all my patients. I think my patients should stay well. With all my best wishes to my patients, thank you.